If you are a nurse who's already tired of the hospital setting, you want to stay away from the bedside, but you still have this passion for patient care, I think home care nursing is an option for you. I'm saying this because I've already experienced two types of home care nursing roles. One was I was in New Mexico. So what I did was I'd have to go to the patient's house, prepare the medications, administer the medications, prepare her meals. I had to bathe the patient, clean the patient. So it was just a one-to-one patient care. Fortunately, most of the patients that I've had when I was in New Mexico were not really very dependent. They were not wheelchair bound or bed bound, so it was really easy. It's like hanging out at a friend's house. So after feeding the patient, we would have to watch TV together. So it was really fun. I was paid a good amount of money at that time. And when I moved to Maryland, there's another home care nursing role that I applied. And I'm so fortunate that I got in, and it's called intake nursing. What an intake nurse would do is to intake the patient into our system. It's like admission into the agency. So the services that we offer are physical therapy, skilled nursing, occupational therapy, and speech therapy. So once the patient is a candidate for home care, so it's determined by my assessment. So what I'm gonna do is I'm gonna go to the patient's house to have the patient sign consents. Of course, I'd have to do my head-to-toe assessment first to see if the patient is really homebound. If the patient is homebound, then I take them into our system. I have them sign consents. I do my medication reconciliation, health education, and so on. I would just be staying with the patient for an hour, and I get paid per patient. The good thing about this job is that it's hybrid. I would have to do my documentation at home. So I stay with the patient, like I said, for like an hour, and that's it. And I get paid. And another good thing about this is that I determine the time when I want to visit the patient. Of course, I would have to consult the patient if the patient is okay with the time that I'm suggesting. So it's very flexible, and it's very liberating because I wouldn't have to deal with the hospital drama. Okay, um, I just have to do what I have to do. I just have to do my job well, and that's it, and I get paid. It's very empowering, and this might be for you, and I would like to discuss this further in other videos. So if you have more questions, just comment, and I would like to discuss anything about what I know about home care nursing. And by the way, I still work as an operating room nurse. Okay, so that's just a part-time job which I really love, and maybe in the future I'll do this full-time. So stay tuned for another video. Bye.